Good morning, this is Dr. Mason. This video is on the axial bones. So make sure you have out your axial parts to know, exoskeleton parts to know document out. And I'll kind of go down that. Now, first of all, the axial skeleton, what does it include? Well, it includes the bones going along the long axis of your body. So that means pretty much straight down vertically. So it's going to include all the skull bones, spinal column with the vertebrae. It's also going to include the sternum, often called the breastplate, and the ribs. And the last one that's going to include is this hyoid bone here. Now this is a bone in your neck, kind of below the jawbone, but much smaller. It's still shaped kind of like a tiny jawbone, horseshoe shaped. And that is a free-floating bone in your neck that helps you swallow because there's lots of muscles attached to it. Skull, hyoid, vertebrae, sternum, and ribs. All right, now I'm going to cover the skull first, and then we'll do the rest of them together. So if you look at your sheet, you're going to have what's called cranial bones. Those are going to be the bones that surround your brain, bones in the skull that surround your brain. And then you're going to have facial bones. And those are going to be the bones that make up your face. All right, so if we look at this skull, you can see that in this area is going to be the cranium. Again, that's around your brain. There's going to be 6 bones there. And then there's going to be more than 6 making up your face, the part not surrounding your brain. So let's go through the cranium first. Cranium, we have a big frontal bone. Now you can tell where these bones are because they're divided by suture lines, and that's where the cranial bones have fused together. And we'll go over the suture lines a little bit later. But you have your big frontal bone, one of those. And then we're going to have 2, look at the side view now, straight down. We have 2 parietal bones, right and left. Take up the bulk of the top of your skull towards the back, posterior. Then we're going to have a temporal bone in your temple area on the side here, one on each side. We're going to have a bone in the back, and that's going to be called the occipital bone, right here. Those are the ones you can see pretty easily. The 5th bone is going to be called the sphenoid bone. You're going to have to take the skull cap off. Here, I took the skull cap off. Took this off, and we can see now down in there. The sphenoid bone is going to be a butterfly-shaped bone. It's going to include this wing area, the body area here, and the wing area here. It's pretty much exactly in the center of your cranium there. And then we're also going to have what's called an ethmoid bone, which is going to be this little bone here that's going to stick down from the skull, anterior part of the skull, inferior part of the skull, down into the nasal area here. Sphenoid and ethmoid are a little bit harder to find. Now let's look at some of the parts of these. And let me just show you these taken off the skull a minute. This is the frontal bone. You can see where the eye sockets would be. Parietal bone, not much to that. The temporal bone, here, sides. Occipital bone, showing the foramen magnum where the brainstem would join the spinal cord. Sphenoid bone is significant because it again, I keep mentioning the butterfly shape there, and there you can see wings, body, wing. And then the ethmoid here. Superior part of the nose up into the inferior part of the cranium there. All right, now let's look at some of the parts of these on the skull. You can see frontal, parietal, temporal, occipital, sphenoid, ethmoid. All right, from the front again, we can see that the frontal bone, because it's in the front, is going to only landmarks you have to identify on that are the supraorbital areas. Supra means above, and you know the orbit is the socket for the eye. So the supraorbital area would be right there. And if we take the separate bone, or we took it off of the skull, we can see the supraorbital area right there. Then we move to the parietal bones again. You can see them there and there. They don't really have any significant landmarks. Besides, they have a lot of suture lines. Suture the anterior part, suture in the middle, suture in the posterior part, suture line here where it joins the temporal bone. So if we take that out of the skull, pretty much no landmarks there besides many suture lines there, jagged suture lines. Again, those were the areas where the cranial bones fuse together. Then we move to the temporal bone is next. Get that guy out of the way. Now we get this guy here. See that right there, and it also includes this little extension here, and this protrusion here, and this foramen canal there. So that has about 5 or 6 parts to find, so let's look at those. The zygomatic process is this little extension here. Now, why is it called a zygomatic process? Well, it proceeds towards the zygomatic bone. Now, we didn't cover the zygomatic bone yet, but that's a facial bone. It's your cheekbone. You'll feel your cheek up there. You can feel that right to the lateral of your eye socket. That's what you're feeling. That's the zygoma. So the zygomatic process proceeds towards the zygoma, but it's a part of the temporal bone. You can see where it stops because there's a suture line there. The external auditory meatus is your ear hole. Meatus is like a canal, and you can see it going through there. Then behind the external auditory meatus is this process called the mastoid process. Now you can feel that behind your ear. If you feel behind your ear, take your earlobe and feel this little bony protrusion behind it. That's going to be your mastoid process. And then we have what's called the mandibular fossa. Now, the mandibular fossa is going to be the part of the temporal bone where the mandible fits in. Now, they have a little plastic rubber piece here simulating cartilage. So let's see what they have on this piece. Okay, they also have it there. But if I flip this over, this is where the mandible would fit into that. The mandibular fossa, kind of like a little depression. Let's see if we have, I'll show you a real skull. You can see how the real skull, the temporal bone there. This is really actually much lighter than the acrylic skulls. Just by trying to lift it with my hand there. But also you can see it's a different color. But anyway, you can see where this mandibular fossa would be right there. I don't know if I can pull that out and still, yeah. So you can see the mandibular fossa right where the mandible fits in there. All right, there's 4 parts of that. Now let's look at a real temporal bone. We took out of the skull here. We'll bring this one over. Okay. Right there like that. We took it off. See if we can get it to sit there, yeah. So now that's temporal bone because there's the zygomatic process proceeding towards what would be the cheekbone. We can see the external auditory meatus there. And this is the mastoid process here. Now if we flip it up a little bit, we'll see, oh, there's that little depression here, the mandibular fossa for the mandible. The interesting thing about the temporal bone is if you go through that external auditory meatus, there would be an eardrum there. On the other side of the eardrum, would be the tiniest bones in your body. They're called the ear ossicles. Now this one really, if I can open this up, yeah, I open this up and we can actually see these ear ossicles. Let's see, I found them earlier here. Here they are, right there. Now when you get to the ear, you remember we have a hammer, anvil, and stirrups there. They're in the temporal bone on the other side of the external meatus. Interesting. Now let's look real quickly on a real skull on the full skeleton here, okay? There's your temporal bone. Right here. Zygomatic process, external intermeatus, mastoid process, and this little dip. There's cartilage there, because that's a joint, synovial joint. So that would be your mandibular fossa, and of course this is going to be your mandible. So this is what you can feel right behind your ear. It's really prominent behind your ear. Mastoid process. Then we move to the occipital bone. Now, occipital bone is the back there, so you can see it right there, the number 3. And in the occipital bone, we have that big foramen, big hole called the foramen magnum. That's where the brainstem leaves the brain and joins the spinal cord. That's the main part of the occipital bone. I think we might have the occipital condyles on there. Yes, so the occipital condyles. We're looking straight down the foramen magnum and the occipital bone here now. Occipital condyles are here. They're little protrusions where the skull sits on the first vertebral bone, C1, the atlas. It's going to sit right on there. So occipital condyles, foramen magnum make up the occipital bone. The last 2 bones of the cranium, the sphenoid bone and ethmoid bone. As I said, we're going to have to look inside the skull to see them. So we took the skull cap off. Took that off. And now we're looking down into the skull. Now let me get one of these ones with the markings on it. So I'm going to take this off. I can get it off one hand. There you go. Very good. So now we can see it outlined. And when we give you a little test on this, we'll make sure we have the ones with the lines on it. Make it a little easier for you. But there you can see this nice butterfly bone here, the sphenoid bone. I'm going to get one over here so you can see the real thing too. So kind of it's going to sit in, imagine the butterfly right in there, and you're taking the butterfly out. Now as far as the parts here, what you're going to have is some wings, a body, and a saddle. So the lesser wings are these smaller ones on the superior. The bigger wings are down in here, greater wings. The body is the middle part, and within the body, you have a saddle right there. And that's called the sella turcica, means Turkish saddle. Actually, what sits down in that saddle is the pituitary gland, which is going to be your master endocrine gland, releases hormones. We need to protect that, and it communicates with the brain. So it sits right down in there. 4 parts. Now, let's look at it outside the skull. We can see lesser wings, greater wings there, middle parts of the body, and there's your sella turcica. All right. It's going to fly away now. I'd like to ride in that saddle, sella turcica. That looks like fun. And then lastly, we get to the ethmoid. Now, the ethmoid, as I said, let me just get that one for you here. So we have this little ethmoid. here. And you got to imagine that sticking right down in there. Okay? And we have to look, it's towards the anterior of the cranium. It protrudes up into the inferior part of the cranium, but the other half actually sticks down into the nose. So our smelling nerves are going to come through this ethmoid bone. That's what all those little holes there are for. And we're going to have a major olfactory tract that's going to be called leading from the olfactory nerves coming up. It's going to lead back to the part of the brain that detects smell. But let's look at the part sticking up into the cranium here. This is called the cribriform plate with the holes for the olfactory nerves. And then we have the crista galli, a little crest here in the middle. Now, if you look at the one that's outside the skull, you can see crista galli there, and the cribriform plate with the little tiny holes in it there. Now, we have to turn the skull like this to see where it protrudes down into the nasal cavity. It's just the upper half of the nasal septum. It's called the perpendicular plate. That's part of the ethmoid bone. And then these ridges over here inside the nasal cavity, these bony ridges, are called concha. And the middle nasal concha, which would be this one here, is part of the ethmoid bone. All these are concha. So, if we look at the four parts, we're going to have crista galli cribriform plate, and then we look into the nasal cavity, perpendicular plate, and the nasal concha, the middle ones there. Okay? On this, again, I showed you the cribriform plate and crista galli, so I have to turn it like you were looking in somebody's nose, and we can see the perpendicular plate there, and then the concha on the sides. All right, now let's look just real quickly at this here. This is called the exploded skull. We kind of separated the cranial bones and the facial bones there, but we want to concentrate on the cranial right now. So you got one frontal, you got two parietals, you're going to have a temporal on each side. Come back here to the occipital, and they even exploded the sphenoid. See it right there. Remember the sphenoid exactly in the middle of the cranium. That's the key bone, actually. If you took that bone out, the whole cranium would fall apart. It's connected to every other cranial bone there. And then we have the ethmoid, which you can see right here. All right. Think you can recognize them out of the skull? I'll put them all here for you. Each has their little landmark. Let me put them like this. Let's go over the suture lines, because remember I said these lines joining the cranial bones are called suture lines. So we gave you four. The sagittal suture here would be like if you made a sagittal cut. Remember, if you make sagittal cuts, you end up with the right and left side. So this is the sagittal suture. This one along the frontal bone is called the coronal suture. I think they should have named that the frontal suture, but it's called the coronal suture, or the crown. Coronal means crown. Then we have the squamous suture here. Remember, squamous means flat, so I guess that's kind of the flattest suture line there. Of course, that's at the superior of the temporal bone. And then the last one is going to be the lambdoidal suture. line here. Superior of the occipital bone. That looks kind of like a lamb's fur, maybe you can remember it that way. Sagittal, you should remember coronal and crown or front. Squamous is the flattest one there. Now, like I said, the sphenoid bone is going to join every bone. It's the key piece. So that would be your frontal bone. This is sphenoid, remember the butterfly bone. Joins the occipital here. Temporal's there. We'd have to come on up where it joins the parietals on the side here. And the ethmoid, of course, it touches too. Alrighty, let's move to the facial bones now. We're going to cover 6 of the facial bones. A few more than that, but those are the major ones. So, here is your face. Let's just go through them and then we'll go through the parts. Basically, we have the mandible. This is jawbone, lower jaw. We have the maxilla here, which is going to be the upper jaw. We actually have 2 maxilla bones. You can see where they're kind of separated here. So let's follow this maxillary bone. You can follow the suture lines again. It's going to have the upper teeth. It's going to join zygomatic bone here. It's going to come on up to the nasal area, up to the frontal bone. So don't think it's just the area around the teeth. It extends laterally. It extends superiorly here. And then we're going to have the palatine bone. Now, the palatine bone is part of the palate. Let me get this guy here. One that has his jaw removed. Okay, here we go. Okay, so there's your palate. Now, what we have to remember about the palate is that it's part of the maxillary bone. And then, that one doesn't show it too well. So let me see if I can get this guy here. Really hard to tell this in some ways. I'll tell you what I'll do. I'll grab a maxillary bone here. And you can see this part here, the main part of the palate is actually the maxillary bone. Right here. The other part, the back part of the palate, you can barely see a line right there, is actually the true palatine bone. The posterior 1/3 of the palate is a palatine bone, a separate bone. Then we have the zygomatic bone, we said is the cheekbone. Again, look for the suture lines. There's a suture line, there's a suture line, and then there's going to be a suture line here with the maxillary bone. Zygomatic bone, cheekbone. The lacrimal bone is going to be a little bone here. It should have an indentation and even a hole in it right there. That's for your tears to drain into your nasal area. So remember, when we get to the eye, we're going to have a lacrimal gland up here. Lacrimal gland makes the tears. They drain down through a little foramen in the lacrimal bone into the nose. So just a little indented bone here to the lateral of the nasal area. And then we have the 2 nasal bones here. That one and that one. So on this side, we can see the lacrimal bone here, an indentation, whatever foramen that they don't show there. All right, let's look at some of the parts of these now. And somehow, I want to get a mandible off here when I get to the palatine bone. Let me see if I can take it off of this guy. Oh, I can see it pretty good in there. Probe. Okay, so here we go. This is the palatine bone. They have a nice suture line there. Posterior 1/3 of the palate. The anterior 2/3 is actually part of the maxillary bone. Okay, the parts. So for the mandible, and let's look at a separate mandible first. Here. We have the condyle. Now the condyle is going to be this protrusion that fits into the mandibular fossa of the temporal bone. So there's your condyle. Right there. On the separate bone, it's the back one. This one also has a name, but we're not going to cover that. That does not articulate with the skull. We have muscles attached to that. This is the one that allows the hinge joint of the mandible. Let's go to the real guy. Here. There's your condyle. This one's not attached to any other bones. Then that makes this vertical part the ramus. Horizontal part is the body of the mandible. And then this little area of the bone around the teeth, it's called the alveolar bone, right there, where it joins the teeth. And that's because there's a little socket here in the bone for the teeth to fit into, and that's called an alveolus. Now let's see here on this guy, the alveolar bone around the teeth. Let's see if the real skull has an empty socket. Here we go. Can get this guy to open for me. Well, we can kind of see here where he's missing this tooth. Here, that would be an alveolus. Let's do it this way. Alveolar bone. And here you can see a empty socket. That would be an alveolus where he lost a tooth right there. This shows it pretty good here. Yeah, there you can see the alveolus really nicely. And all that's alveolar bone around the teeth. So right where it joins the teeth, they're calling that the alveolar margin. The other thing about the mandible, it has two foramens we want to learn. The anterior foramen around the chin area is the mental foramen. Has a nerve there leading to your chin. Mental means chin in Latin. And the other one, if we look at a real mandible here, we see the two mental foramen. The other one is the mandibular nerve that goes through the mandibular foramen. So you have to look from the back, posterior view of the mandible, and you can see it coming in right here. That's the mandibular foramen with the giant mandibular nerve that goes to all these posterior teeth. So here, let's look at it from the back. You can see mandibular foramen. And then if we turn this way, you can see that that mandibular nerve and blood vessels comes and leads to all the teeth. So when we numb this nerve up as a dentist, we have to hit it way back here, and it numbs your whole side of your jaw up for the mandible. So what we used to do is we'd come across the needle like this, and we'd have to hit the middle of this ramus right here with the anesthetic, and it would numb up this whole side. For the top teeth, there's a nerve that comes down off the trigeminal nerve you're going to learn about, that comes down, and then it sends individual nerves to these teeth. And since the bone's a lot thinner in the maxilla, upper jaw bone, then you can give the needle right there by the tooth, and the anesthetic will soak through the bone and numb the nerve up. But the mandible's a lot thicker, so you have to actually get that mandibular nerve from the inside back there. I don't know if you ever noticed, but if we use this one again, the dentist will kind of grab this part of your jaw and wiggle it with his fingers. And then he'll bring the needle across and try to bisect this ramus so the needle hits it right in the middle and come across about at the canine area, maybe the premolar area, and just kind of bring it back like this. Hit the bone, tap it, aspirate to make sure you're not in the blood vessel, pull it back a little bit, inject, numbness, local anesthetic. So the only way to find that mandibular foramen is look at it from the inner side there. Mental foramen you can find near the chin area here. See what we see in here. Okay, you can see the alveolar bone around those teeth. Mandibular nerve of individual nerves leading to the teeth. All right, enough about the mandible. The maxilla. Again, you have to follow that maxilla bone there. Just really appreciate the full extent of it. There's two. You really have one mandible, but two maxillas. And we think of this part around the teeth, we still have the alveolar margin and the alveolar bone around the teeth. But we also have a little zygomatic process of the maxillary bone, but it's different. It's also proceeding towards the cheekbone, so it's not quite as long as the zygomatic process of the temporal bone. Then we also have a frontal process because it's proceeding towards the frontal bone. So these processes are named after the bone that they're proceeding towards. Frontal process of maxillary bone, zygomatic process of maxillary bone. And then when we get to the palate, here, this will be the palatine process of the maxillary bone, the anterior 2/3, because it's proceeding towards the true palatine bone here. Process proceeds towards that bone. So the anterior 2/3 of the palate here is the palatine process of the maxillary bone. That's the palatine bone, 13 there. All right, now we move to the zygomatic bone. And we're not learning any parts of that, just to recognize that that is the cheekbone. To recognize the suture lines, temporal bone in the back, maxillary bone towards the anterior, proceeds up to the frontal bone here. The lacrimal bone I already pointed out. Let's find that on a couple more skulls. Let's look at this guy real quick. Okay, we can see where it's, I know the lighting is in here. Isn't that good? Maybe from here you can see it nicely from this side. I got more light. Okay, little bone that has an indentation in the lacrimal. And then we can see the two nasal bones. Because remember your nose, most of your nose that sticks out here is cartilage. So these tiny little nasal bones back at the bridge of the nose. When they say you break your nose, usually they're talking about breaking the cartilage, not the nasal bones, although you can break them. All right, there's a couple more facial bones on the list, but I'll just point out this inferior part of the nasal septum. They actually call it the vomer bone. These inferior nasal concha are separate bones as well. All righty. Now on your list, the last thing we'll talk about is the orbit and the sinuses. I'll make a separate video on the vertebral column. The orbit is actually 8 bones, and of course that your eyeball fits in there. But if we look in the orbit, we're not going to have to learn what these bones are inside the orbit. Just remember there's about 7 or 8 in there, and that's why a fractured orbit is so hard to fix, because there's so many bones there. But if we had to identify them, which you're not going to have to do, but you might want to just try to find them for fun. Frontal bone, sphenoid bone. Here it looks like part of the zygomatic bone. Maxillary bone. Got the lacrimal bone there. We got the ethmoid bone in there as well. Look them up and see if you can. Now, this is interesting. We have a frame in the back here for the optic nerve to go back to the brain. And lastly, we'll cover the sinuses. Now, the sinuses are air-filled spaces in your bone. They have a mucus lining, so they can help trap bacteria that get into your nasal area. They're actually called paranasal sinuses because they surround your nasal cavity. They also make your skull a little bit lighter, so your head isn't so heavy. Now, where we have these sinuses, there's one in the frontal bone, about right here. That would be called the frontal sinus. So if you get a sinus headache, it's usually from them. We have two giant ones in the maxillary bone about right here. Maxillary sinuses. Those are the ones that usually get full of mucus and clogged when you have sinusitis. We're going to have one in the sphenoid bone and some in the ethmoid bone. There are actually also going to be some in the mastoid process here, but let's look at this lateral view. Sagittal cut of the skull, we can see some of them here. Okay, so here, the frontal ones, if we turn the skull like this, we can see it here. It's the frontal sinus. The maxillary sinus, we'd have to open this up here. And let's take a maxillary bone. And one of these maxillary bones I had showed the sinus, yes. So here's the maxillary bone. Sinus would be right in here. So if I flip this over, you can see how big that is, actually. Huge maxillary sinus. It kind of sits right on these back teeth here. Sphenoid sinus. Get this guy here. Sphenoid sinus, remember I said the sphenoid is pretty much exactly in the center. It's going to be a big one back here. There's sphenoid sinus. The ethmoid sinus is a whole bunch of small ones. And remember, the ethmoid is anterior to the sphenoid, so it's going to be some little sinuses up in here. Let's look at a sphenoid bone. Remember the butterfly bone? Okay, here. Well, there's big sphenoid sinuses in the body there. You can't really see the opening, but that's where it would be within that body. The ethmoid bone, you can actually see all the multitude of sinuses in there from the superior view and from the anterior view. A whole bunch of sinuses. Let's see what they show. Exploded skeleton doesn't really show it. I think one of these did show the, I remember seeing, yeah, so the mastoid sinus, which is on the list. That's huge there. Let's see, we also had a lateral sagittal view of the head. I'm just going to walk over here, see if I can find that lateral view of the head. Oh, I don't see him, but I know it's here somewhere. Well, I might have to show you that. I'm going to look around. It's nice to tour the lab, isn't it? Okay, here we go. So here, you can see this lateral view here. There's nice. I'm glad I took the time to find it. There's your frontal sinus. That would be your sphenoid. They don't really show the ethmoid sinuses, but they'd be right up in here. Because remember, you got nasal, ethmoid, sphenoid. Working your way back. Nasal bones, ethmoid bone, sphenoid bone. So if you had to do the sinuses, frontal, ethmoid, sphenoid. Maxillary, not going to show it from the outside, but it would be right in here for the sphenoid. I mean, the maxillary sinuses. All right, the last thing I will show you is a skull of an infant, because we mentioned somewhere on there, I remember we mentioned the fontanelles. Now the fontanelles is before these suture lines joined, we had these soft spots. You've heard of soft spots. They're called fontanelles. There's a membrane there, but it's not bony, because these bones have to continue growing and merge. So one of the fontanelles is right here, where the frontal bone and the parietals are trying to join there. There's some other ones, usually some back here, but they're not showing that. All right, we will see you for the second half, which is going to be the rest of the axial bones here. Sternum, ribs, hyoid, and vertebral column.